Hey everybody, I wanted to go over a case study. This month we're going to be talking about traumatic brain injury, and this was a pretty cool case study on post-concussion syndrome / traumatic brain injury in the gut-brain axis. Um, Through our lectures that we're going to be doing with Dr. Brandon Brock, we're going to be talking a lot about the clinical applications of functional neurology, how you as a practitioner but also as a patient can begin to look at things to heal these different types of issues, and then also nutritional strategies to help affect these. So this is a pretty interesting case, and we're going to try to walk through it pretty quickly, so I don't keep you too long. But basically, I really got interested in learning about this because of this particular patient. And when I started looking at the literature, I tried to figure out, hey, is there a correlation between brain injury and gut dysfunction? And what I found was, I know that you've seen this post before, but Banzel et al., his team, they discovered that if there is traumatic brain injury, there can be a leaky gut, and it can be as soon as 6 hours after the traumatic brain injury. And with a healthy brain, what they found was that there was better gut integrity, so there's less leaky gut. And of course, these are mouse brains, but what they found was that there was a correlation between traumatic brain injury and gut dysfunction. This is a really good paper by Summon et al., and it just basically talked about the loop, the gut-brain axis, the gut-brain loop. And one important thing I took from this was that in the initial stages of traumatic brain injury, you are supposed to have some inflammatory responses to go in and clean out injured areas. But through the course of the healing process, those microglia that go in and clean out the structures and clean out some of the dysfunction and inflammation in there, they should start to turn off. What I've seen in persistent post-concussion syndrome or persistent issues of traumatic brain injury is that there is increased activation of the microglia and that they don't turn off. And so you have this persistent neuroinflammatory mechanism, which you see in the letter F there back at the top of the loop. This paper really showed that if you go to the gut to try to fix the brain, you can make some good changes. So it basically says that the gut-brain axis may be a therapeutic target to reduce the risk of CTE and other neurodegenerative diseases following TBI. So again, that's just a correlation. And anytime I'm approaching a patient that I don't know too much about, but I have a good foundation, I always like to go to the literature to try and build a little bit of confidence in what I'm doing. They also mentioned that TBI was a silent epidemic. I think this is a really important point because a lot of people are suffering from post-concussion syndrome or chronic traumatic brain injury issues, but they're being told that everything's normal, everything's fine. No, there's no way that the gut issues that you're having could be related to your head. Those are two completely separate body parts. It makes no sense, but it really does. And it's important that we're beginning to see that even though some of our scans come back normal, some of our blood work comes back normal, there is dysfunction no matter what. Even if you hit your head just a little bit, or if you have some bad gut dysfunction, it can cause brain issues. So this paper was really good, and if you do our courses, I'll make sure to provide all the full resources that we provide in the courses. I really like what they said here in number 2. Head injury should be treated as a disease process, not a static event. It's not like you can go in and just do a couple therapies and you get better. This is something that should be treated as a chronic disease, and people do have to change their lifestyle after they've had a traumatic brain injury. Foods have to change, the environment has to change. Sometimes therapies or exercise has to change in order to accommodate and to try to build back that better brain and try to make it better than it was before, because it's possible. You can do that. This paper goes into a little bit about not only the physical manifestations of traumatic brain injury, but also the neuropsychiatric components that can lead to the pathogenesis of neurodegenerative disease. And again, that's another really important point. I know you've seen in some of our posts, we talk about how anxiety or stress is a frontal lobe related issue. And if you do hit your head, a lot of times you will find dysfunction in the front part of the brain, which is the part of the brain that is really kind of a brake and serving as a mechanism to control some of our outbursts of emotion or ruminating thoughts. And so when there's damage there, it can create a lot of changes in that neuropsychiatric component that we're seeing. So the patient that I saw, she's at the time a 27-year-old female. She had been seen by several different doctors, functional medicine doctors, gastroenterologists, general medicine practitioners. And basically, no one could really figure out what was going on with her. So the answer was to put her on an elemental diet. Now, an elemental diet can be great for supplementation, but it was never really invented to substitute food. There was a couple of problems with this. Yes, she was able to get nutrition in, which was an amazing thing for her, but it was costing her a ton of money. She was spending $2,000 a month on this powder substance, which again, she was sustaining. It was okay, but she wasn't thriving. She wasn't living. She wasn't being her best self. So we had to try to figure out, and she's 27. Like, in my mind, I'm thinking when I was 27, if I'm going to spend $2,000 on food, I want a freaking cheeseburger. You know what I'm saying? So her history, whenever patients come in, I have them fill out their goals. And as you can see at the top of the page here, 3 of her goals were to improve her attention span, improve her gut motility, and improve her balance. This is someone who has been suffering for almost a full year and hasn't eaten a full meal in over a year. And one of her goals wasn't even able to eat. I don't even think it was on her radar at this point. So, I looked at her and I said, we got to get you to eat. And I didn't know how we were going to at that time, but I knew that we could try and figure it out. And she also filled out a bunch of survey questions, trying to direct me on my physical exam to where we need to focus parts of the physical exam. So this section talked about her ability to digest food. So it looked into the GI system a little bit, and the 3s are bad, the 0s are good, and she had lots of 3s. It also asked about her gag reflex, which showed that she was having an abnormal gag reflex, which to me tells me that there's a lack of integrity in the vagal system. She also suffered from chronic migraines and dizziness. She had been diagnosed with 3 concussions, SIBO, small intestinal bacterial overgrowth, and pancreatic insufficiency. She'd been to everybody. So when she came to see me, there wasn't too much hope, but I think we were able to change that mindset after the exam. She had a lot of neurological issues too. This is a questionnaire that we use to assess different parts of the neurological systems. And she had episodes of dizziness, difficulty with balance. Her musculoskeletal system was off. So lots of interesting things I found there. And then of course I asked about some of the neuropsychiatric side of things, nervousness, panic, how's your brain functioning with attention? Are you having ruminating thoughts? And everything lit up like a Christmas tree that showed that she's having dysfunction there. Mentally, she hasn't felt the same since her last concussion. Her stomach got a lot worse and the treatments really stopped working. So, there's something called second impact syndrome where your brain's kind of primed. Like you have that microglial cell priming. And then if you have another head injury after that, it gets harder and harder for the system to get back to regulating itself. And that's where I think this 3rd concussion kind of came in. It was the straw that broke the camel's back, and she suffered to a point where she couldn't eat after that 3rd concussion. But interestingly enough, everyone kind of wrote the concussions off like they weren't a big deal because scans came back normal. Any type of blood work that would even be related to inflammatory responses of the brain kind of came back normal and were written off. But in my mind, I thought, okay, literature shows correlation. I'm going to look for things on my physical exam to see if systems that are responsible for digestion are off too. And I found that there were. She had absent gag reflex. She had little to no bowel sounds. So again, that's going back into the vagal system, telling me that there's some sort of dysregulation between the front part of the brain stem, and the rest of the body. She also had some great difficulty when I would put her in different positions. She had a lot of vestibular dysfunction. And then with her eye movements, we saw a lot of changes, which I won't go into detail, but that tells us about different parts of the brain that might not be functioning as well as they should. This image here that you see, this shows us what's called her center of pressure, basically where her brain thinks her body is in space. And all these little symbols should be right in the middle, and they weren't for her, which just showed me that there was some dysfunction there. She still had a pretty decent score, but she's a young 27-year-old. I assumed that she'd be all greens, but her vestibular system was basically affected as well. So I had some confidence after my physical exam. I said, look, I have an idea. Based on your history and your exam findings, I want to make a bet. And she looked at me like I was crazy. And I said, I bet you one gluten-free burger that by the end of this week will make improvements to your 3 goals, but also you'll be able to eat your favorite food. And then she looked at me, she's like, bacon? And I said, bacon it is, my friend. Who wouldn't want to eat bacon? Sorry for vegetarians and vegans out there. Anyways, so my thought process for her was, okay, I see dysregulation in her vestibular system. And this is kind of crazy in my thought process, but if your vestibular system's off, if you feel like you're moving, if you have episodes of dizziness, your brain is not going to want to be hungry. It's going to initiate more of a sympathetic tone, more flight or fight response, and you're not going to be in that rest and digest state. So one area that we had to work on first initially was to make your vestibular system calm down. So that's what we did. First, again, I looked back at the literature, and it showed that there was significant correlations between head injuries and changes in dizziness and also in the vestibular functioning. I won't go into too much detail here, but it basically talked about how patients that suffer from traumatic brain injury or post-concussion syndrome can have what's called benign paroxysmal positional vertigo, or a vestibular disorder, and that it showed that multiple treatments for that could make them better. And this is just, one piece of the puzzle, but it gave me a little confidence in what I saw in my physical exam and what I could do as a therapy. It also showed that cerebellar DTI, which is diffusion tensor imaging, which are some really cool images if you ever just Google them. It shows that there's abnormal or aberrancies in the cerebellar system after an MTBI. And I found that on her intake paperwork and on her physical exam, she had cerebellar related issues. VR, which is vestibular rehab, is the treatment of choice for these types of patients. So that's where we started. And some of the treatment that this paper talked about was gaze stabilization exercises, gait and balance training, and then just general vestibular conditioning. So that's what we did. After we did a couple of sessions of that, you can see that her scores got a lot better. I would put her into different canal repositioning maneuvers. We'd have different types of brain exercises for the cerebellum. And then I also had her work on her eye movements because I saw some insufficiencies there. So I felt at that point we had a nice foundation in the vestibular system. And at that point I said, okay, now that we've got the area to calm down, how can we increase vagal tone? And as I saw in the physical exam, that there were changes in vagal tone. But looking back to the literature, and I know that I posted this earlier too, that same team that created traumatic brain injury and saw leaky gut said, hey, what if we stimulate the vagal system? Will it increase the integrity of gut function? And what they found was that even with a traumatic brain injury, if there's increased vagal tone, there's going to be an increase in tight junction efficiency, which means that there is no leaky gut. It also went on to find that there were less inflammatory markers in patients that had increased vagal tone or vagal stimulation, which I thought was huge because the neuroinflammatory side of a concussion is absolutely important to address from a nutritional side. But this also showed that functional neurological, or I should say neurological stimulation, can actually dampen the inflammatory response, which if there's a persistent neuroinflammatory response in a concussion, we've got to try to make that better. So that was cool. And this just talks a little bit more about that. I won't go into detail. You can read it if you want. But their experiments support the concept that vagal stimulation prevents intestinal injury after TBI. Great, I'm going to use that. And there's ways that I can do that without having to implant any vagal nerve stimulators. So some of the things we did to increase her vagal tone was I had her perform some deep controlled breathing exercises, belly breaths. We had her doing gargling to activate the vagal system. Activating the posterior muscles in the throat can activate the vagal system, which was important for her because she had an abnormal gag reflex, and we were trying to build that system back up with exercises. I had her singing on a trampoline. My thought process for this was having her bounce up and down will activate what you'll see in a second is called interoceptive processing, basically increasing the brain's awareness of where internal body parts are in space. So by jumping up and down a trampoline, there's going to be distension, which would activate vagal tone, and then having her sing would activate posterior muscles. So there's a combo exercise there. I had her husband perform belly rubs on her at home, just to try to increase some of the brain-body connection. Nothing more than that, just to try to get some efficiency there. And then she was actually doing coffee enemas from the advice of her functional medicine provider. So we had her continue that, but we made some changes to it. We made her do the coffee enema with a caffeinated coffee, and what I had her do is hold it in as long as she could. To increase functioning of the frontal lobes, because when you have to go, but you can hold it in and you can hold it in for a longer time, that means that the frontal lobe is activated a little bit more, and it's going to fire into those pontine centers where the vagal nuclei live and increase the efficiency of those pathways. And that's something that Dr. Karazian talks about in one of his books, which is a great resource for anyone out there. But also, I'd have her chew some sugar-free, like healthy gums and stuff like that. Just to try to activate the mastication muscles of one of her cranial nerves, which will also fire into the pons. which will activate vagal systems. So as you can see, all we were looking for, I'd have her fill this out frequently throughout the week. We just wanted to see if those 3s would start to shift towards 0s, and that's what they were doing. Her gag reflex was coming back, which was awesome. She was having less of these anxiety-like feelings and symptoms, and things were starting to get better. Step 3 in the system, so my thought was we've got a great building foundation of the vestibular function now. Vagal tone is not 100% there, but it's getting back intact. Now I want her to be able to eat. So my whole thought process was, if you haven't eaten food in a year, we've got to work on some visualization. We've got to reestablish your relationship with food. For the time, it's been this horrible relationship. Like, if I try to eat you, I'm going to get sick. So I looked at what's called interoceptive processing, and this is a great paper by Dr. Karazian that talks about the traumatic brain injury and the effect on the brain-gut axis. I posted a little bit about this in posts, but basically interoceptive processing is, like I mentioned earlier, it's the brain's information that's coming from visceral stimuli such as pH, dissension, ischemia, inflammation, touch, smooth muscle contractions inside the belly. And I just wanted to see if I could use that as a therapy. So this paper talks about how eating is affected when there's interoceptive processing issues and interoceptive processing conditioning. And it also talked about a little bit about visual feedback. So I wanted to be able to use those different types of therapies to make her brain better and make the gut better. This was kind of cool. So this paper talks about how there's taste-like cells in the gut. I won't go too much into that, but again, I'm always just looking at the literature to establish a little bit more confidence in the therapies that we're doing and practice what I like to think is evidence-based medicine and therapy. So this paper talked about how salivation to the site of thoughts of food is influenced by food preference, hunger. It basically talks about how my thought process was, even if I just had her look at the food that she likes, we could start to prime the digestive system, because if you've ever thought of or heard of or seen, if you like bacon, or smell it, your body thinks it's getting ready to eat, so it'll start to salivate and start to prime those digestive enzymes. So that's what that was part of her therapy. That's what we had her do. I had her do some meditation, some visualization, putting herself back in the kitchen, thinking about what she's going to cook. I would have her eventually start to cook that food and then to smell it. And then I would have her start to chew it and then spit it out, see if she'd mount an immune response to try to reestablish what's called oral tolerance. And then eventually would get her to eat the food, which was pretty darn cool. So how's she doing? I keep up with her pretty regularly, but she's kicking butt. So this was right after therapy. She basically started eating. Her veins were looking better. She's looking less cachexic, I guess you could say. She was basically starting to thrive. This was a picture she sent me a few weeks after the therapies where she's able to eat a gluten-free burger. So that was one of her goals, which is pretty cool. I asked her where the invite was. She didn't invite me to eat a burger, but maybe next time. But she's doing really good now. She's up to 54 different foods, I believe, or more at this point. But she's back to eating, and I equate that all back to reestablishing that gut-brain connection. So again, this is a short little insight into what we're going to be teaching. I hope you enjoyed it, and I really hope that some practitioners out there that are interested in this get involved, because I truly believe that the way that we're doing functional neurology now is still so much in the future that we really need to keep doing this for patients that are suffering. And for the patients as well, if you want to learn more about this, jump in, because you're with yourself 24/7. You should know this better than anybody. So anyways, thanks so much, guys. I hope you have a great day, and we will catch up soon.